50% of students have burnout. Yeah, right. Well, there's something fundamentally wrong here. Something fundamentally wrong. Same edition of JAMA study, another survey, showed that 14% of students met the criteria for moderate to severe depression, worse in women than men, by the way. Seriously considered suicide, 4%, and 15% seriously considered dropping out of school. What kind of a learning environment is it when our students are responding like this? I like patience. I love to tell this story because it was such an eye-opener for me. I teach a course in quality and safety at our School of Public Health. My students are about 2/3 of them are doctors, about a third are not, about a third are overseas students, but they're all people who are interested in improving quality and safety. And so they're an interested, highly motivated group. They're wonderful people. It's a privilege to teach people like this or to learn from them. A couple of years ago, at the suggestion of Maureen Vizignano, the head of the Institute for Healthcare Improvement, she just told me about this, and I said, gee, that's a neat idea. I gave my students a new assignment. On the first day of class, I said, your first assignment is to find a patient with a serious medical condition who is willing to talk to you about it. And I want you to interview them and just ask them what it's like to live with diabetes or multiple sclerosis, cancer, whatever it was. Just ask them what it's like to live with it and just listen. Don't give them any advice and don't make any suggestions, just listen. And then ask them what their experience has been with the healthcare system. And then I want you to write a 2-page paper. I have 60 students, and I'm by myself, and I give them 4 papers, and so they're all 2-page papers. But I say, you got to learn to write briefly, because that's only 2 pages. So anyway, 2-page paper. Page 1, I want you to describe what you learned. Tell the patient's experience, quote what they said, and so forth. And page 2, I'd like you to say what you see are the implications for improving quality, agenda for quality, sort of a nice way to set the course up so you can see what the problems are. It turns out to be the most fantastic thing I've ever done in my teaching career. It is a fabulous experience for the students. The doctors come up and say, I had no idea, I wish we had to do this in medical school, because of course as a doctor or medical student, you don't do that. You're interested in your patients, you spend time with them, but you never sit down and say, tell me what it's like. And when they did that, they found it was really quite impressive. So it was really fabulous for the students. But it was also quite transforming for me because, of course, I got to read them all. And in that first year, I'm only going to refer, it hasn't changed a whole lot since, but this is like the first year experience. I had 61 students, 20 of them were overseas students, so let's take them out, although their experiences weren't significantly different, but let's just talk about the American 41 students. Of those 41 students, of the 41 patients, 30 of them had serious problems with being treated badly by their doctors and or nurses. He treats me like an idiot. He's always not interested in what I have to say. He doesn't like questions. He won't return my phone calls. Nobody will tell me what's going on. Do they ever talk to one another? I was afraid something would happen to me in the hospital because people didn't know my story because they didn't explain to one another or share the information, and so forth, and so on, and so on. Now, it wasn't 3/4 of their experiences. Most of these people, most of the time, had positive experiences. But 3/4 of the patients had sometime an experience that no one should ever have. When patients are sick, they are vulnerable, they are anxious, they are frightened, they are worried. Our job is to heal them. If we can do that physically with our medicines and our treatments, fine, but emotionally we can always help. And it's our job to do that, not to make things worse. And these were episodes that made people instantly worse. So we have some serious problems. And we can look at these and realize that what we're talking about isn't just the way you may have been treated by one of the professors isn't just the way a nurse may have been dissed, not just the way a patient may have been dissed, but the fact that there is a problem with disrespectful treatment across the board, and the question is what are we going to do about it. We had the roundtable on reforming medical education a couple of years ago, produced this report, and one of the things that I insisted on, Diane 100% support of this with me, was that we have on the roundtable some students. David will remember we had 2 students there, and as well as 2 patients. And we had a discussion about what needed to be done, reforming medical education, the usual sort of thing, and we came up with some recommendations. That's our unmet needs. But the first was what I call the usual suspects, and that is we made a recommendation that medical schools should teach patient safety as a science, that it should be part of the medical curriculum, and that students should learn about human factors and safety improvement science and systems design. This ought to be part of the curriculum. Would you expect us to recommend? Of course we recommend that's fine. We certainly feel that's important, and we did. And we also said it's important that the students learn about how to interact with each other, and that the behavioral aspects are important, and particularly that students should learn teamwork. You learn interprofessional teamwork by working interprofessionally, so that all medical students should have educational experiences with nursing students, pharmacy students, etc. That ought to be the norm, and of course it doesn't exist in most schools. But the thing that really stopped the conversation was when one of our medical students spoke up and talked about an experience where he had been humiliated by his professor, his teacher. And the room got very quiet, and then somebody said, well, how often is it, how many students have this experience? Without batting an eye, he said 100%. Well, the AAMC person, oh, that's not true. We have surveys, we know it's only 18%. Oh, it's only 18? Oh, that's pretty good, yeah, pretty. But anyway, they've since backed off from that, and I got a phone call from him this last week. New results are it's like 47% from the day. Anyway, forget it. That's not the point. Whether it's 100% or 18%, it's much too much. But the point is, we began to realize that the biggest problem in medical education isn't that you're not learning safety science, is that you're learning a lot of bad ways of acting from your teachers. And if we want to improve healthcare, we better go to the source, which is the faculty and the learning environment. So we made as our #1 recommendation that hospital leaders and deans need to put priority on creating a learning culture that not only emphasizes safety and teamwork and professionalism, but also emphasizes how we treat one another. Because, of course, as some sociology wag once said, which I didn't know who it was, imitation isn't the main way we learn behavior, it's the only way. And we all learn to be doctors by imitating doctors. And so it's very important that we come to grips with this. We think it's absolutely essential to eliminate the hierarchical authority gradient, which has been part of medicine since day one, that we have to have professionals who understand that professionalism really is a matter of treating people with respect. We have to have a zero tolerance policy for egregious disrespectful behavior. We also realized, of course, in order to do this, we had to have a huge development operation.